Canine parvovirus is a viral disease from the Parvoviridae family that affects the digestive system, particularly in puppies. This disease has a very high mortality rate, ranging from 80% to 90% in dogs that do not receive treatment. It is important to note that this virus does not affect humans, as there is another virus in the same family called Parvovirus B19 that affects people. Therefore, you and your family are safe if your dog has it. The symptoms are very clear. Patients experience constant vomiting, especially after eating or drinking water. However, a distinctive characteristic is the presence of constant diarrhea, which may contain blood. In fact, puppies with parvovirus literally begin to empty themselves, leading to rapid dehydration in a very short period. This prevents the body from obtaining nutrients, resulting in a state of asthenia or extreme weakness. This weakness is especially severe in puppies, as they need nutrients for their growth during this stage. Bloody diarrhea occurs due to the necrosis of the intestinal villi. The intestine is lined with villi, which are responsible for absorbing nutrients and contain small veins and arteries. When inflammation or cell death occurs, circulation is compromised, causing bleeding inside the intestine. This blood is not absorbed and is therefore expelled. In addition to diarrhea and vomiting, a fever may occur. However, these symptoms are not exclusive to parvovirus, so laboratory tests, such as virus isolation or ELISA testing, are necessary to confirm the diagnosis. One of the main problems is that these tests are not immediate, and the disease can cause death in as little as 12 hours, depending on the virulence of the virus. Therefore, it is crucial to conduct a thorough anamnesis to make quick decisions. Questions such as the origin of the puppies and whether they are vaccinated are essential, always supported by a vaccination card or certificate. If everything indicates that the dog has parvovirus, treatment must begin immediately. This includes supportive care, such as fluids to hydrate the patient, analgesics and anti-inflammatories to control inflammatory processes and general discomfort, and antibiotics to prevent secondary infections, as these can worsen the prognosis. Antispasmodics are also administered to control the motility of the digestive tract, and in some cases, antivirals are used, although their success is not guaranteed. The main goal is to stabilize the patient so that their immune system can take action. Additionally, water and food should be restricted until they no longer cause vomiting. In my experience, many patients overcome the disease, but those who do not respond to treatment usually die within a maximum of 48 hours. Parvovirus is a virus that can survive in the environment for up to 6 months and is resistant to UV rays from the sun. If a dog presents with parvovirus, it is advisable to disinfect the environment where it usually lives, such as its home or the clinic where it was treated, using sodium hypochlorite or quaternary ammonium, as the virus is somewhat sensitive to these substances. In adult dogs, cases are usually milder due to their greater capacity for intestinal epithelial regeneration and a more mature and developed immune system. To prevent the disease, there is a vaccine against parvovirus that should be administered when the dog is between 1.5 and 2 months old. This age is crucial because before this period, maternal immunoglobulins are still circulating in the puppy, and it is after 1 month that these begin to decline. The goal is for the dog to develop its own immunity and immunological memory to fight the disease. It is important not to administer this vaccine in combination with others, such as multiple vaccines. If too many antigens are given at the same time, the puppy's immune system may not respond adequately to all of them. As a result, it becomes a gamble with diseases. This is why it is recommended to administer vaccines individually. Another measure to prevent this disease is to avoid taking your puppy outside until the vaccination schedule recommended by your veterinarian is completed, especially for this disease and distemper. Additionally, contact with other dogs should be avoided until the vaccination regimen is fully completed. It is better to be safe than sorry. I hope you enjoyed the video. If you did, please give it a like. And if you know someone who has a puppy, share this video to keep them informed. If you have any questions, feel free to leave them in the comment section. If you're new, I invite you to subscribe. Thank you so much for watching this video. See you next time.